FMGE June 2026 Dermatology Recall Questions. Hello dear students, myself Dr. Maddineni Srinivas. Welcome back to my YouTube channel. So let us begin the discussion without any further delay. And these MCQs are also very important for the upcoming examination. And also remember, NB can do anything. It has introduced the video based real type of questions which many students are telling in this examination. So probably they may also give the same type of questions in the NEET exam also. So fortunately in the dermatology they have only given image based questions but no any video based questions. So let us begin the discussion. First question, a 28-year-old sexually active male has history of transient painless genital ulcer and now presents with swelling in the inguinal region. Examination reveals that both inguinal and femoral nodes are separated by the inguinal ligament producing the groove sign. They are enlarged. And what is most likely causative organism? So if this was the question which was given, we have discussed in the class, very important topic, STD. So what will the answer? Groove sign, if you remember what is that causative organism, I have remembered with the help of the RGV in the class. So it is LGV, and RGV is famous for media, getting promotions from the media for movies. So media is Chlamydia trachomatis. So that's how we remember this. Answer is option C, and you should remember even the serovars L1, L2, L3 are responsible for the lymphogranuloma venereum. Right. Next MCQ is a pediatric dermatology integrated question. Child is presented with fever, painful oral ulcers, vesicular lesions over the palms and the soles. What is the most likely diagnosis? Yes, it is hand, foot, mouth disease. Very important topic. And also there was another question which students told me that the same disease was asked, what is the organism responsible, and it is enterovirus, which is basically Coxsackie virus A16 and also enterovirus 71 and also Coxsackie virus A6. So option A is the correct answer here. So let us look at the next question. So this also I keep this image in my class and I will explain the students. In the examination there was only description that cauliflower like growth is seen over the genital region, right? So this picture, whenever my students listen to my class, they will remember and they will also feel ugly about the gobi Manchurian. So cauliflower like lesions are going to be seen in the case of the warts, genital warts, which are produced by the human papillomavirus. Very easy question, but since the image was not given, many students felt it was difficult. But my students, they know cauliflower like growth is HPV. A man presents with the intense itching, especially at the night time. Nodular lesions are seen on the scrotum. He lives in a crowded house environment. The clinical image is shown below. They have told that there was a picture showing the nodular lesions over the scrotum. Yes, by this time, if you have thought of the diagnosis as a scabies, your diagnosis is perfectly right. And remember, in scabies, what is the primary lesion which is seen? Yes, it is going to be the burrow. And remember, dear students, in scabies, the scrotum can have the nodular lesions which is mentioned in this question. Okay. So I hope this video was helpful and you have felt that these were the MCQs which are really asked in the examination. Please do that like button. Also do hype this video, okay, so that it will reach to many students. A patient with BL who is on MBMDT, multibacillary MDT therapy for borderline leprosy patient is now developing sudden redness and swelling of the existing skin lesions along with the pain and the tenderness. There is inflammation. What is this condition? First of all, you should think of, we have already discussed this, very important, it is type 1 lepra reaction where the pre-existing lesions are going to become inflamed, right? And you are able to see it is the face image which is have kept it, but maybe there was some other image or there was no image. Please if you feel anything is different from what was asked in the examination, please do put those differences in the comment section. I will check out them and I will try to modify and improvise these questions and options in the upcoming recall videos, right? So this is a type 1 lepra reaction, right? What is this managed with? So remember dear students, this is not a drug reaction, so the MDT which is being given should be continued, so we can safely strike off the option C and D. So we are left out with two options. So this is type 1 lepra reaction, type 1 or type 2 lepra reaction. The treatment is going to be the same, continue MDT and start the patient on the steroids. Very important, treatment of the leprosy reactions is very important, and this is what students told me that there was another question. Pregnant woman is now diagnosed with the multibacillary leprosy. Which of the following is the most appropriate treatment? So remember, dear students, we have to weigh the risks and benefits of giving the medications in the pregnancy. But in the case of leprosy, giving the treatment is very, very beneficial. So we are going to give the standard MDT with rifampicin, clofazimine, dapsone in the pregnancy also. There will not be any difference. Even in the case of the reaction, if the pregnant woman is having this reaction, the same course of the treatment protocol is going to be followed. And there was one more question based on the dosages on the leprosy patient. So in the paucibacillary leprosy or multibacillary leprosy, the treatment will be with the same 3 drugs. They are going to be the rifampicin 600 mg once a month supervised dose. It will be dapsone 100 mg daily dose, and clofazimine in between. It's once a month and also daily. Clofazimine 300 mg once a month supervised dose and 50 mg daily dose. So this is going to be given for 6 months in the case of the paucibacillary patients, and it will be given for 1 year or 12 months in the case of multibacillary leprosy. Next MCQ, a 38-year-old brownish patch inguinal region for the 5 months, no history of itching, it is asymptomatic, Woods lamp examination is shown, and yeah, it is also mentioned, it seems, a coral red fluorescence. So what is the treatment of choice for this condition? Remember, this is a bacterial infection due to Corynebacterium minutissimum, that is Erythrasma. So in this, what will be the treatment option? We have to give an antibiotic. So oral erythromycin is going to be the better option. So if there is any other option, you can please put it in the comment section. And next question, I can say this is a little bit tough question for you because it's a NEET question, but it was asked in FMGE now. Patient is presenting with linear depressed lesion over the forehead extending onto the scalp. Okay. And it was mentioned that there is hair loss and also the atrophic skin changes were seen over the forehead and the scalp. So this was what students told me. What is the most likely diagnosis for this condition? Remember, dear students, actually this topic is very important. Recently in the NEET examination also, and it was asked 1 or 2 times. So this is a form of the scleroderma, localized scleroderma, which is called as Morphia. And precisely in this Morphia also, there is special type of Morphia which is called as N-Coupe saber, in which saber means a sword. Okay, if you remember saber tibia, so tibia which is looking like a sword. So likewise here saber means a sword. So what happens is the forehead is going to be having a depression, just like someone has hit this patient with a sword. So that's why this term saber is there in this options in this disease name. So maybe I hope at least you might have ruled out the other options. And are these the real options which are given in the examination? If there is any difference, please put that difference in the comment section. Okay, this is definitely a difficult question, I can understand it. Right. Next question, 26-year-old acne vulgaris planning to be started on isotretinoin, and some students told that image was given which was having some pustules. So if it was given, please hit that like button, okay, or in the comment section you can write yes sir, the image was given. Right. Now the question is the baseline investigation which have to perform before initiating the therapy. So remember, dear students, it's the isotretinoin, acitretin. These are retinoid group of drugs, and these can cause derangement in the liver function, and also they can cause the increased hypercholesterolemia and hyperlipidemia. So we have to perform the liver function test and also do the fasting lipid profile before initiation of the isotretinoin. So answer is going to be option A. Next, the question mentioned that an elderly person coming with basal cell carcinoma like lesion near the medial canthus, and they have asked you that though this is a small lesion, but why is it considered as a high risk or high grade? So this was what students told me. Is this the same question? If so, please hit that like button. Right. Okay. And what are the options? These are the options. If there is any discrepancy, put in the comment section. So remember, dear students, basal cell carcinoma is a locally aggressive carcinoma, and I hope you remember the other name for this condition is it is going to produce a rodent ulcer because of its aggressive growth locally. It will not metastasize, it will not spread hematogenously, it will not spread lymphatically. Okay. So now with that knowledge, what will be the most likely answer? It is locally aggressive invasion it is going to produce invasion into adjacent orbital structure. That is possible. So this is going to be the better option in this particular option group. If there is any other discrepancy in the options, please do put that in the comment section. So it does not have any propensity for the metastasis, it does not spread through the blood, and also there is no possibility or complication of the metastasis into the brain. So we can rule these options. So it's going to be option A, which is a better choice here. So I hope this video was helpful. If so, please do that like button. Also do hype this video so that it will be motivating for me, and also other students like you are going to be helpful. And you have done all your hard work, so just relax for some days, FMG warriors, all of you, right? And those who are NEET warriors, I know you are facing the most difficult times, but continue the preparation for a few more days. It's only almost 2 months of time. You're going to do awesome, great, all the very best. Thank you so much for watching this video till this point. If you have any doubts regarding dermatology, you can ask in the comment section. Thank you so much, and all the very best. And if there is any other question which was asked and which I missed, put it them in the comment section. Thank you so much. Happy learning. Sarvam Sri Krishna Pranam Sarvajana Sukhna. Bye bye.